Hi, welcome to Is Autoimmunity Really Genetic? My name is Barbara Solomon. I'm a board certified nutrition specialist and certified functional medicine practitioner. And tonight we're going to dive into the world of autoimmunity. So I have to start with the disclaimer. First of all, I'm not a doctor, and the following is for information only and not intended to be used to diagnose, treat, cure, or prevent any illness. This should not be considered medical advice and is not a substitute for care by a licensed medical doctor. Okay, that being said, let's talk about what autoimmunity is. Now, according to the American Autoimmune Related Disease Association, over 50 million Americans suffer from some type of autoimmune disease. It has become more common than heart disease that affects about 22 million people, and even cancer, which affects about 9 million, and that's according to the National Institute of Health. Now, researchers have identified between 80 to 100 different types of autoimmune disease and suspect at least 40 different other diseases, additional types of diseases of having an autoimmune basis. Autoimmune disease is one of the top 10 causes of death in female children and women in age groups up to age 64 years. So this is really affecting a lot of people. So we really need to pay attention. Now, women tend to be disproportionately affected more so than men, representing about 80% of the people with autoimmune disease. So for instance, diseases such as lupus and Hashimoto's affect about 9 to 10 women for every man affected. If you're a woman, you might have more susceptibility to getting autoimmune disease, and that's definitely what I see in my practice. Autoimmune diseases fall into two general categories. There's systemic autoimmune disease that go ahead and damage organs, as well as there's autoimmune diseases that go ahead and damage tissues. One of the big issues with autoimmunity is that once the immune system becomes dysregulated, there's a greater opportunity to create autoimmunity elsewhere in the body. So you can end up having concurrent autoimmune disorders. Now, the theory is that many of us believe that autoimmunity is genetically based, but it turns out that there's many factors that can drive autoimmunity. So there's genetic factors, inflammatory factors, there's the microbiome or the gut, and there's the environmental factors. And what we're going to do is look at each of those in detail. So let's look at an example of genetics, and we're going to look at thyroid in this case. And there is a gene called CTLA4 that affects the thyroid. And if you have a SNP or you have some genetic defect that causes this gene not to work so well, you may have a disposition to having issues with your thyroid. And if that's the case and you have environmental exposures that affect the thyroid, say you eat a lot of gluten or you eat a lot of iodine or those types of things, you may have an immune system reaction. And that immune system reaction may affect thyroid function. And once that thyroid starts to become inflamed, it doesn't work so well. It's not able to do the things that it's supposed to be doing. And you'll go to your doctor's office and they'll go ahead and go, wow, you have hypothyroid. It's just not working so well. When it turns out that actually you have hypothyroid because you have a problem with the immune system attacking the thyroid. And the issue with autoimmune thyroid is that if it attacks it a little bit, the thyroid gland doesn't work so well. If it attacks it a lot, then these excess hormones start spilling out, and then the thyroid starts to overcompensate and release a lot of hormones. And so then you get diagnosed with hyperthyroid. So if you tend to go between symptoms of hypo and hyper, you may have an issue with autoimmune thyroid. So in this genetically based model, we end up developing something called immune dominance. So if you look on this chart, you see there's a Th1 and a Th2, and those are two different types of immune response. And basically, what they're supposed to do is balance each other out. We're born with Th1. That's our innate immune system. And then as we become exposed to things, we develop something called a Th2, or an acquired immune system. And that way, every time that you're presented with a pathogen that the body has seen before, it doesn't have to do all that legwork, all that groundwork in order to fight the infection. Instead, it goes, hey, I've seen that, and it lets the system go ahead and handle that. So basically, if you think of this, it's supposed to be a seesaw, and it's controlled by this Th3 regulatory system. So it goes up and down depending on what type of thing you're exposed to. If this becomes dysregulated and one of these systems becomes more dominant or stronger, in this case, Th1 is a lot stronger, and so it doesn't allow the acquired immune system to work as well as it should anymore. And when this starts to happen and becomes dysregulated, you develop something called a Th17 inflammatory response. And so this is the pattern when we talk about genetic susceptibility to autoimmune thyroid. Environmental factors can also play a role in developing autoimmunity. Now, we're looking beyond diet and we're looking beyond infection. There can be things like drug interaction, there can be physical stress, there can be things like enzymes or neurotransmitters that have an influence, insulin surges, estrogen surges, infections, heavy metals, those type of things. And what will happen is that it can cause the gut lining to start to break down. Our gut lining is designed to encapsulate things in order to process foods, in order to keep things out of the system that shouldn't be there. But with these type of things, it creates these weaknesses in the gut and that allows things to pass through into the bloodstream. Now, when this starts to happen, it activates the immune system. And ultimately, if the immune system is well overworked and it sees this happen all of the time, there's this possibility of developing autoimmunity. So here's an example of how this works. Now, we talk about gluten, and recently we talk about latex-containing foods. Now, gluten has been linked to over 55 diseases so far, and most of them are autoimmunity, and they're not just against the gut. You can see you can develop against the skin and the testes and the liver and so on and so forth. Now, the third factor is our biome, and this thing is huge. And Dr. Jeffrey Bland has been one of the forefront pioneers when talking about the influence that the biome has on the body. It has huge influence on our genetic expression as well. Our biome is amazing. We have about 2.5 to 3 pounds of bacteria living in our intestinal tract, and they have their own personality basically, and they produce their own substances that can affect the immune system. Now, our gut is where 50% of our immune system resides, and it talks to the bacteria 24/7. And so we need to make sure that our biome is very, very well balanced, because if not, and things go awry, we can start to develop lots of different infections. And these infections can't be killed off because the good bacteria is not there. And once you start to do that, you start to weaken the immune system. And then the immune system has this propensity then of being overworked and developing bigger issues such as autoimmune disease. The fourth one is infection. And, we talk about regular infections and Yersinia there's lots of different things like Klebsiella and Yersinia and things that have definitely been shown in the literature that can lead to autoimmune disorder. But there's something also here called cell wall deficient bacteria. And cell wall deficient bacteria are designed to be symbiotic. They're basically go into the body and get rid of things that shouldn't be there. They act as like scavengers to get rid of toxins and to get rid of degenerating cells and tissues. And the problem with cell wall deficient bacteria is they need cholesterol in order to survive and to replicate themselves, but they're unable to make it. So they commonly live in things like our brain, our muscles, our liver, joints, things like that have a lot of cholesterol richness, so to speak. Now, the problem is if we are acidic, or if we have bad dietary choices or chlorinated water, or our ability for our mitochondria to make energy becomes compromised, or we have gut dysfunction, that allows these things to overgrow. And once they start to overgrow, they can go ahead and have a huge effect on our immune system. And if our immune system once again becomes affected, then it can't do the job it's supposed to do, and we have an opportunity of developing autoimmune disorder. There's also a clear correlation between viruses, especially Epstein-Barr, with autoimmune disorder. So again, this is nothing new. This has been out for a long period of time. It's just something that I want to bring up. Autoimmunity, because it affects so many different places and it affects it with different levels of intensity, it can be very difficult to detect, and you may not know that you have it. There's some basic symptoms, that it can include fatigue and just not feeling well and dizziness and joint pain and rash, but it really maybe even a fever, but it really kind of depends on the individual. And so there's testing that you can do, overall testing, to determine if you have inflammation. You can look at SED rate, you can look at C-reactive protein, you can look at an enzyme called LDH. You can look at alkaline phosphatase. There's lots of different markers that you can look at. Even levels of increasing levels of LDL cholesterol might indicate inflammation occurring, monocytes, inflammation occurring. So there's lots of different things. But if you really want to get specific, there's a lab out there called Cyrex Labs that's been around for the last 5+ years. They really have nailed this down pretty well, and they've created these tests so that you can determine, wow, do I have autoimmunity? You can look right into the neurological system, or you can look overall to see if there's autoimmunity going on. So if you're working with a practitioner and you just can't seem to get to the root cause, you might consider that you might have an autoimmune basis and go ahead and do some of this testing. Now, the best way to support autoimmunity is to first to determine if there is a genetic factor, looking to see if there is environmental factors, if there's an infection space. But the idea is this: regardless of the cause, you've got to go ahead and support the regulatory system. You've got to get that thing working again. It has to, the regulatory system has to turn on the immune system when it's supposed to turn it on and turn it off when it's done doing the job, and not just keep running amok. So it's really important to do that, and you can do that with things like vitamin D and essential fatty acids, a good multi-mineral. There's lots of different tricks we have up our sleeve to try to get that thing rebalanced again. The next thing is to kind of determine dominancy, to determine if you're a Th1 or Th2 dominant. So if you tend to have a problem with high levels of antioxidants affecting you, maybe you drink tea or coffee or chocolate, or you take large amounts of antioxidants, you find you don't feel well, that may be affecting your Th2, and maybe you're Th2 dominant. Whereas if things like licorice or echinacea or astragalus or maitake mushrooms or things tend to set you off and make you not feel so well, then you might have a Th1 dominance. So this is just kind of a trick to be able to say, hey, what kind of dominance do I have? And you need to work with your practitioner to kind of figure that out. So the idea of knowing dominance is important for two reasons. For one, we don't want to strengthen something that's already too strong, except if you're sick. If you're sick, we want to involve the type of immune response that works great. So if you're Th2 dominant and you get a really bad virus, maybe drinking a whole bunch of green tea is going to be your ticket out of there, because your Th2 system is really, really strong. And if we give it the thing that makes it stronger, it'll have a better opportunity in fighting infection. We also want to look for those triggers and avoid them. Get rid of the bacteria, take a good probiotic, drink your kombucha, look for gut infections and get rid of those things. Don't continue to eat a diet that creates a lot of inflammation, that causes gut permeability issues, that causes the immune system to be overreactive. So we want to make sure that we avoid those trigger type of things. In addition, we want to go ahead and make sure that we do dietary support. So again, looking for those things that you may have an intolerance to. Maybe you have a problem with nightshades. Maybe you have a problem with gluten. Maybe you have a problem with dairy. You need to find those things out, maybe with the use of an elimination diet to help you determine those, and to get those out of your diet to give the immune system a break. Okay, that's all I wanted to talk to you about autoimmune. I just wanted to give you a quick taste so that you can have a good, informed conversation with your healthcare practitioner. If you'd like to find out more, there's a lot more I've written about autoimmune on my website. You can read about that. So go ahead and check us out at functionalhealthforyou.com, or you can read a lot in our new book called Eliminating the Pain of an Elimination Diet. It's a functional medicine approach to diet and health-related issues. Thank you very much for listening. Have a great day.